virtual hug to LaCasta. Thank her. We have a real hero in this room. She goes to the hospital every day. She risks her life every hour, every day. She hasn't taken a break. She hasn't taken a day off, I believe, since last December. LaCasta is right now working in New England, and she still has her scrubs on, it appears, since she just finished an all-night shift. LaCasta, good morning, good afternoon, good evening. We have people here from the United States, people here from Israel, and we have a worldwide audience which is waiting to hear what you have to say regarding coronavirus and the present state of the medical situation here in the United States. How are you?
I'm good. I'm very good this morning. The one thing I do need to clarify is I'm not a specialist. I'm just a nurse that has decided to work with COVID patients. I'm not a specialist. I've decided to work with them directly.
But if you're working directly with COVID patients and only COVID patients, doesn't that make you a specialist?
I guess it could in so many terms, but I'm just a standard nurse who's decided to work only with COVID patients.
Okay. Now, I understand you've worked as a nurse for several years. You work as a traveling nurse. I had the pleasure yesterday of actually meeting with LaCasta. I invited her out to a nearby park, which was unpopulated, and we were able to sit down at a picnic table with a little bit of distancing and take our masks off because it was a very clean environment. Would you say it was a clean environment? It was a safe environment, what we did yesterday?
Yes, sir.
Okay, so would you say that it is safe for people to go out to a park as long as they're maintaining social distancing?
Yes, sir. You can still, it is still safe from what we understand to have your normal activities as long as you maintain social distancing.
Now, I've also heard an argument regarding social distancing that it's actually the wrong term, that it should be called physical distancing and not social distancing. Because we're not socially distancing ourselves. Here we are on Zoom, on the internet, talking to each other.
I've heard people term it that way too. I think it would all be about how you take it as a personal definition. Social distancing doesn't mean to isolate yourself from, the people around you or to completely cut yourself off from the world. It is just, you need to stand at a distance from other humans.
So what would be now, is there a distinction between, let's say, in terms of social distancing or physical distance, is there a distinction between how far you stand away from someone with or without a mask?
Safety is safety. There's a difference between the type of masks that people choose to wear. The purpose of social distancing is to literally just to keep you out of the spray of germs.
Okay. All right, before I start to ask you some more specific questions, I would just like to let you open up in terms of what you feel, where we're at, where did this virus come from, how are we basically, handling it? How are you handling it? So if we just take a step back in terms of a little bit of history, you could, introduce yourself somewhat, better than I can, and what your situation has been and what you have observed.
I've observed many things in a range from asymptomatic patients to patients that are very ill. It is an acute respiratory disease. Where it comes from, I do not know. Nobody really truly honestly knows where it came from. There are suspicions that this is not the first time that it has entered our civilization. But unfortunately, in the early 20th century, we didn't have a way of testing it and actually considering what it was. If you read your history books in 1917, 1918, World War II, we had an outbreak of what they called the Spanish flu, which had very similar symptoms and massive amount of deaths. I'm the average person that believes that if we don't learn from history, we're doomed to repeat it. Social distancing is what is going to keep us safe. We have flattened the curve drastically, but I do not believe that we're prepared or ready yet to completely open our country back up or our world back up to what it was. And we may never go back to a baseline of what it used to be. This may be something similar to our new norm.
Do you believe that the human handshake is now something which belongs to history?
Personally, yes, I do, because I can't guarantee that the person's hand that I shake has been properly sanitized. The only thing that you can do is make sure that you protect yourself. I do believe that it will teach us how to be much more sanitary human beings. Be more conscientious of when we simple things as when we cough or sneeze or how close we come to a human. But in personal reasoning, yes, the handshake is a thing of the past for me.
How about a kiss?
Yeah. Well, I've never really been one to kiss strangers, Joel. um, um,
How about a kiss with a mask?
oh yeah, that's fine. I've worked with plenty of nurses that are teams, husband and wife teams, and they have special ways of being affectionate. And those of us that work on the same team, we become close, fellow nurses and aides, and that we come in contact with every day that we work with. We become family, and we've developed ways of giving praise to each other without having to expose each other. I saw the most beautiful picture on Facebook the other day of a husband and wife. They both had on face shields and they were both completely garbed. They had gloves and they were just touching foreheads. And, sometimes it's just simple human contact that makes you comfortable.
I have to say one of the most interesting questions I've seen online and also on television is, and I'm going to ask you the question without projecting any opinion. So I want to get your raw response, your raw primal response. And the question is it safe to make love?
It's never really been safe with strangers, but if you're with a trusted partner, you don't social distance yourself from your spouse or your family. So I don't see that it should affect personal relationships. I don't understand how it would. It may affect those of us like myself. My mother lives in an entirely different state, and so does my father. My child lives in a completely different country. It may affect things like that, but your domestic partner, I don't see how it should affect you, because in layman's terms, you're already sharing germs.
Well, yeah, I was scratching my head when I read the question, and that was, if I make love to my partner, can I get the disease? And I'm
Well,
thinking, aren't you breathing next to each other? I mean,
you're already breathing next to each other, sharing utensils and cups, and I wouldn't end any relationships because of this.
okay. So just watching the room activity here. So that takes me back into, how do people contract the virus? I know that I just came from a coffee shop in Israel. We call it a beit cafe, where I just got myself a fresh cup of coffee in the last half hour. And in doing so, I made sure that entering it, I used a napkin so I wouldn't touch the steel handle of the door. And then, and as I went to pour myself some coffee, I made sure to take a napkin and I pulled the lever so the coffee would come into the cup or into my thermos. So again, I'm protecting myself from the plastic. But like a real idiot, and you can tell me if I was an idiot, I totally forgot. When I went to grab the cream or the milk, which is also in a plastic container over there, I went, you idiot. Because now I was coming into direct contact with the plastic container. And so here I took care of the steel door to get in. I took care of the lever to pour the coffee, but I then grabbed the plastic container. what is our concern in terms of contracting the disease from other people and from surfaces?
Um, I I like the fact that you used a napkin. I believe myself that using a disposable product to open your doors or do what you need to do is better than wearing gloves, because people put on a pair of gloves and then they go on about their normal activities as though it's just their skin. And even though you're protecting yourself, you may not be protecting other people. I've seen people have on a pair of gloves, sneeze in their hand, and open a door. Okay, yes, you protected yourself, but you did not protect the rest of the community. Um, it's all about a personal thing, but myself, I like the disposable means much better. Grab a napkin, a tissue, or something. A lot of doors, people don't look down, but a lot of doors, especially public restroom doors, if you look down, there is a foothold where you can open that door with your foot. You know, cover your hand with your sleeve or something to that effect. Nobody's ever going to be perfect when it comes to it. And some people think that just because they have on a pair of gloves that they're safe. You just because you have on gloves doesn't mean you're completely safe.
So you're
Um,
suggesting to use a disposable napkin or a tissue in contrast to a glove?
like when you reach for a door handle and you're unprotected, yes, that would be much wiser than covering your hand with your sleeve. Or I've seen people with gloves that it makes no difference that they're wearing the gloves, because they may protect their self, but they're not protecting anyone else. They're still spreading germs.
Okay, so I've seen people use their elbow to put their elbow into the handle to open the door. Then they use their right or left foot to keep the door open as they then walk into a room or into a building. What do you think about that?
If that's what, that's better than touching it with your bare skin, but we also need to make sure that it can adhere to cloth. We have no proof of how long it can live on certain fabrics, but it can adhere to cloth.
When you say cloth, you talking about cotton products or
Yes, your clothing, whether it be cotton, polyester, whatever the blend you prefer for the day is. Um,
and for about how long? Do you know what the life would be?
that I do not know, and I don't even know if they have tested it yet to see. You have to remember, we're only 6 months into this worldwide. It's brand new to us and our technology. We don't know.
I know there are a lot of studies which are being conducted right now. What I have read in terms of, we'll talk about surface now, then I'd like to go person to person, uh, is that it appears that the worst surface that you could touch or come into contact with would be plastic. For some reason, it attracts itself to plastic. It stays alive a lot longer. That at first I just thought it would be maybe a few hours, maybe 2 or 3 days. And then I've just read a study where they did a research on the cruise ships where the passengers had disembarked, those who were positive. They checked their staterooms and they said it was still after 15 days. It was still alive on the plastic inside that room. So that's information that I have heard. I guess there's a lot of information which is being passed around. Some is real, some is factual, some is myth. And again, that's one of the reasons why we've invited you to be here to be able to answer some of our questions. What is the most common way of contracting the virus?
Through droplets, someone sneezing, or um, any type of moisture that expels from the body that enters the mucosal membrane of your body, which includes your nose, mouth, and your eyes. Your eyes are mucosal membranes.
So if someone sneezes or someone coughs, that's a big red flag.
Yes, there is a spray that you cannot see.
Okay. And what can we do to prevent ourselves from being part of that spray, from those germs, from that virus, from hitting us?
To prevent yourself, of course, you would want to wear your mask. Those of us that actually wear glasses, we're a little bit safer. If you're standing around somebody and they sneeze, in all honesty, I would just say move away. That's what we do with a patient at the point where some of us have to wear, because we do wear eye protection just to be able to see every day. Our eye protection varies. I have some that I've seen they wear the full face goggles with the rubber band on the back that completely protects their eyes. If one of my patients goes to sneeze, they're much more protected than myself because I'm unable to wear my glasses underneath that. I wear just regular, oops, and I've dropped my glasses. Regular standard goggles, which fit over top of my glasses. Face shields protect you, but it needs to be sealed. Like if you're wearing your mask and your glasses fog up, you don't have a good seal on your mask. You can still inhale it. Oh, now I can see.
And you've got very nice blue eyes too. I'm sure your
My
patients
eyes
tell
are
you
green, Joel.
that. Blue, green. Okay. I guess the virus is affecting my eyesight as well too. So if I understand you correctly, you're saying, Joel, and everyone who's listening to this program, if you want to take some measure of caution of not contracting the virus, wear a mask.
A mask is your safest route at this point, especially when you're in public. You don't need to wear it in your car. If you're just walking your dog and nobody's around, you're safe. But a mask is guaranteed. Well, I can't say guaranteed. A mask does help. If all you have at the time is a surgical mask, it's been shown that if you take a baby wipe or a Swiffer and dry out a baby wipe and put it underneath your mask, that still gives you the 95% filtration as though you have purchased an N95. They're made of the same material.
I'm glad you brought that up because I was wearing a mask and I felt, okay, I'm good, I'm cool, I'm good to go. And then I spoke to you. So we basically have almost like an exclusive story, to anyone who is watching and listening to this special Zoom event. Again, I just want to identify this is the United States News Agency, the Israel News Agency, and the Jewish News Agency sponsoring this special event and speaking with LaCasta Thomas. She is a nurse who is specializing today in treating coronavirus patients. And getting back to LaCasta, in regards to masks, and I believe this is basically an exclusive because I've only seen one person on all of network television discuss the effectiveness of masks. Now, the mask I was wearing, according to LaCasta, and you correct me if I'm wrong, was only about 30–40% effective. It would protect other people from getting the virus if I was sick. It would not protect me. And then LaCasta then said, Joel, I want you to wear this. And she gave me an N95 mask. There are masks and there are masks. And I believe you had said that that mask will not just protect the other people, but it will also protect me as well. Where the other masks the virus will go right through them. Is that correct?
According to studies that we've read and the training that we've received, now I haven't spoke with anybody directly from the CDC, but the training that we received, yes, the particles of the coronavirus of COVID-19 are small enough to transfer through a surgical mask. It's better than no protection at all, but studies show that it can transfer through the mask.
But not a 995.
An N95. No, studies have shown that it doesn't transfer through an N95. An N95 is 95% filters out 95% of all particulates. N95s are the same masks that you see painters and spray foamers wearing, asbestos workers. Those are N95s as well.
All right, so just to clarify, I think the majority of masks that we see out there, it's a great idea and it works. It prevents other people from getting sick. And this is the one thing that I keep hearing and I kind of object to right now. I keep hearing it on all the various networks. I hear it in the media. They say, wear a mask. Well, wear a mask because it prevents other people from getting sick. They don't finish the sentence. The full sentence should be, wear a mask. It prevents other people from getting sick and prevents you from getting sick. They don't come back with the second part of that sentence, unless you are wearing what's known as an N95. So if you're able to find an N95 mask, that's the mask that you want to wear. Now, you also had told me too that you don't have to dispose of it. You don't have to throw it away. Is that right?
Yes, sir. They are disinfectable. Um, we disinfect ours currently with a UV light. We use them for 5 shifts. Every shift, we disinfect them through a machine that provides the UV light. Bleach is a wonderful disinfectant. Um, of course, you don't want to soak it in bleach. You are able to just clean the outside of it with a small amount of bleach and allow it to dry before you put that back on your face.
Now, how would you do that? Would you do that by wiping it or by spraying it or both?
The material itself, it's like a cotton, a natural material. We spray them. I've always sprayed them. Wiping them kind of disintegrates and breaks it down, just like if you wipe, a t-shirt or something.
So you're suggesting to spray.
Yes.
And what would be let's say examples of good sprays to use on a mask?
Bleach.
So a bleach spray.
Yes, there is not, it hasn't, I haven't researched it lately, but it has not been proven that Lysol kills it.
The President of the United States, who was not being sarcastic because he was talking directly to medical experts. He wasn't talking to reporters, he was talking directly to medical experts. And this is a big thing now here in the States. He had suggested that we should think about injecting ourselves with disinfectants. What do you think of that idea?
My honest opinion is that is about the craziest thing I've heard in most of my 43 years of life. Since that man came on TV and stated that you can research it, there has been an uptick in calls in the poison control centers, especially in New York City, of people ingesting things as Lysol and bleach, things of that nature. They're not safe for human consumption.
It's poison.
Yes, sir. There's a reason a bleach bottle says do not drink.
So your advice to the general public in regards to injecting or drinking disinfectants would be?
To not do it. There's a reason that bottle has a warning label on it that says do not ingest.
Many, I'm not going to get into politics, but many Trump supporters would say that's fake news. I'm going to drink some bleach.
Well, unfortunately, sir, I watched that interview with my own eyes.
I would imagine that there would be a lot less Trump supporters if that's what happens. If they all believe that it's fake news, and they all start drinking bleach, it's but I'm trying not to smile. I'm trying not to, for some of us, it is so facetious. It is so absurd. It's so perverted. It's so crazy.
But unfortunately, there are people that don't know better.
Yeah, exactly. And that's the reason why I'm being somewhat serious, in terms of asking you a serious question regarding is it safe to drink or inject yourself with disinfectant. So you've said no, it's not at all whatsoever.
No, sir, it's not. It's not even, you're supposed to wear gloves when you use bleach or the germicidal bleach wipes that we use in the facilities, in the hospital. They're not even safe. They have labels on them that say do not expose to skin, do not wipe the body. Please, it is not safe to drink bleach.
Okay. Thank you for really clarifying that. Let's talk about some of the stuff that you've gone through, of which we have already. You have mentioned to me that, and I know you are responsible for saving hundreds of lives, but you have also, as you've said to me, you've bagged a lot of people. You want to discuss that?
I don't know as though if I've saved hundreds of lives. I do my job. just help them do what I'm supposed to do and carry them through. But I have, yes, sir, I have seen a lot more death in the last 6 months than I have in my whole nursing career. Um, it's sad to say, but I have.
And what is the terminology for bagging? Is that what you guys call it when someone expires?
That's not the appropriate terminology, but that is, that's pretty much what it boils down to is when someone's deceased and pronounced, they're placed in a bag, in a body bag.
So if one is not practicing social distancing, if one is not wearing a mask, one contracts this disease. From what I understand from you, you watch them slowly drown to death.
Most of the patients that I've seen lose, yes, sir, it's very similar. It's very similar to watching a patient suffer from pneumonia. COVID, the secretions that it makes inside of the lungs, the body just can't seem to cough it up. Usually when you cough, when you have a common cold or pneumonia, your cough is what we call productive. When you cough, the secretions, you actually are bringing them up. You're bringing the secretions up when you cough. So the difference is they're not able to bring it up. It's thick. The cough isn't deep enough and productive enough. What I've heard mostly is from my patients, it's an irritating cough, like a post-nasal drip cough, a tickle in your throat. And that cough isn't deep enough in the lungs to bring the secretions out.
What are the symptoms of coronavirus?
A fever, the cough, and shortness of breath, a tightness in the chest, similar to asthma.
Are these all three at the same time, or could it be one? Could it be two out of the three? I mean,
it could be one, it could be two, it could be all, it could be none. I've had many people, many coworkers that have been completely asymptomatic, that have turned up to be positive with the coronavirus, and we've had no symptoms at all. A fever is one of the first things to let the body know that there's any foreign invader in there. That is a natural immune system reaction.
So we are now in the month of April. A lot of people are suffering from allergies. A lot of people are sneezing. When you sneeze, should you let everyone know that you've got allergies so that you're not freaking them out?
Most of us in the healthcare field, we do, especially those of us that are traveling, experiencing new environments. It's our allergies.
So you said that's a good thing. In other words, you suffer from allergies. For the most part, you're not positive. You're not suffering from COVID. Tell people that I've got allergies.
Yes, I honestly will tell an individual I have allergies. I've sneezed a million times. Being in New England, I am not from New England. It's a different air environment, and yes, I get tested. I'm negative, and it is just simply my allergies.
Where are you originally from, LaCasta?
I was born and raised in Southern Michigan, the cereal capital of the world, Battle Creek.
Okay. And you spent some time in Texas, I believe?
Yes, sir. I've lived in Texas for about 18 years.
And you work as a quote-unquote travel nurse.
At this moment, yes. That's what they call us, as travel nurse. When I'm at home, I try to stay in the trach and vent, respiratory.
All right. And so where have you traveled to? Where have you practiced?
During this crisis, I've stayed in New England.
Okay. Now you had mentioned to me, two things, one of which I know is fact and one of which is myth. So I'm gonna take a shot at you right now, LaCasta. New York is not New England. Okay.
Oh my gosh, I had that discussion with some friends at work. Yes. Oh, that is. I am so sorry.
And New England's not New York.
Well,
And
to you New Englanders and New Yorkers, it is not. But to the rest of the country, sir, it is New England.
you could say it's the Northeast. It's the Northeast. But you did say something which was very interesting, and that was that you believe that the Northeast is a hot spot.
I do, but you can look at the news and see that. But I simply just think that it's because of the excuse me, the the tourists and the immigration. People don't plan to go to Texas to we don't really have much to offer, but people don't make tourist trips around the world to come to Dallas, Texas. People plan to come to New York City.
Okay, all right. Or Boston perhaps as well too.
Yeah.
But I just noticed you just coughed, which brings me to something also that you had mentioned to me, and that was the fact that you believe that you may have had the virus, and now you've passed it, and you may have antibodies. What does all that mean? When do you think you had it?
According to the belief is that it ran through Texas in December and January. We had a large influx of what we thought was the flu. When people were swabbed, many nurses I know were ill. When we were swabbed, it wasn't the flu. I don't know about everywhere, but I know in Texas that when you have the flu and it is not the yearly strand of the flu, it has to be reported to the CDC. They could not figure out why so many people were suffering from respiratory illnesses. And at this point, we're testing for antibodies to see that if we did have it, because our blood could help create a cure. But I know many people that in November, December, right around New Year's, actually, I shouldn't say November, December and New Year's were very, very ill. I had a friend that was hospitalized due to it. But at that time, nobody thought of COVID-19.
So back in December, people were chronically sick. I mean, they were near death, and you knew it was in the flu. And the word, the terminology, COVID-19 or coronavirus, hadn't really existed, so no one knew what was going on.
Not yet in America. It hadn't. What we did is used our judgment and treated the symptoms. They said that there's been a lot of deaths all over the world that they have just chalked up to bacterial pneumonia or, viral pneumonia. But it's too late to go back and test those people.
So right now, I understand also that you go through testing every week. Is that correct?
Yes, sir. That's on a voluntary basis.
Okay. And through these tests, they discovered that you do have antibodies.
Yes.
And I also understand there is treatment today where people can take your blood and was it called plasma treatment, I believe?
That I don't know. I haven't researched it. We donate to assist with making a vaccine.
Because a friend of mine had said, why don't you get to know LaCasta really well, and you could sell her body. You could sell her blood. And from what I've read and seen is that people that have antibodies, such as yourself, in fact, what I'm aware of, and from the Jewish community, what's happening right now in Brooklyn is that there are thousands of ultra-Orthodox Jews who were among the first to be infected, and they are donating their blood. They're donating, and that's a story that I just read yesterday. Thousands are coming forward to donate their bloods because they believe that they have antibodies that could be infused in patients who are extremely sick, and they find that within 24 hours, the coronavirus disappears.
I haven't read that about it disappearing. I have read that there are lots of Orthodox Jews that are donating plasma to help create a vaccine. Yes.
Another thing too that another thing that I've heard is the virus is really finding itself attracted to the Black population, and it's also creating a lot of strokes. I mean, you could be Jeremy's age. Jeremy's a few years younger than me, and he could be hit with a stroke as a result of blood clotting taking place. What can you tell us about that?
With it affecting the Black community, I'm not an actual expert, but African Americans are already predisposed to certain genetic disorders, diseases, and not all of them are actually genetic. Um, it could also be that you're, I don't quite know how to politically say this, but a higher number of the Black community lives in a lower income society, lower income areas, and they're packed in closer together. That makes them more susceptible. Um, it's they don't have the means, or simply able to have the internet access to be able to telemed with the doctor right now when they're sick. Um, Already we run a higher risk, for cholesterol and blood pressure. Um, Prostate cancer is the number one killer of Black men. But I think that it comes down to more of the fact that when you look at, for example, I really don't want to say anything politically incorrect. When you look at, for an example, if you look at the projects in the inner cities, they are mainly populated with minorities, and Black being the population of that, or the dominance of that minority. Well, those people don't have access to something as simple as the internet to get on there and look up and see if what they hear and learn is fake, to make sure that they are protecting themselves appropriately. Something as simple as cable television, just to be able to watch a something from the CDC, to learn from it.
Right, right. Okay, and in regards to blood clotting, I understand
That I
that.
truly do not know.
Okay, all right.
Blacks have already been a little more predisposed to strokes due to blood clots because of high cholesterol. It has a lot to do with our diet.
Now, why don't you tell us about your daily day? You right now you're working night shifts. What time do you get to the hospital, and what do you do there?
Well, I work in a recovery center. I don't work in a standard hospital. What I work in right now is a facility that is for people that are not sick enough to actually be in the hospital, but yet they're not well enough to go into a standard nursing facility or just join the community. My day it's like any other person's day in a facility. We go to work, first we have to make sure we're protected before we even enter the facility or enter the wings. And we monitor. There's not much that we can do but to monitor and make sure people remain comfortable and stable.
So the majority of patients that you work with, are they stable? Are they getting better, or are they
Yes,
getting worse?
The that I'm at right now currently, yes, they are getting better. Of course, everybody has their things that may happen, but they are people that have already been on the ventilators and went through the dog fight, and now it's time to get them back healthy and strong so they're able to go home or go back to the facility that they came from.
So now that you're working in a recovery center, in other words, they got the virus, they went through the fight, they went through the hardest part of it, as we know, and now they're in the recovery stage. Have you seen people regress? Have you seen people go from recovery back into the heart of the beast, back into being?
Not back into the heart of the beast as saying COVID, but back into the heart as of things that have happened due to it. I have seen blood clots, DVTs, deep vein thrombosis, lots of them, due to the inactivity that it causes, the COVID causes from people, blood clots in the legs. I have seen people with acute respiratory distress syndrome. You know, their lungs are still repairing from that. So we have to make sure that, you know, just something as simple as taking a breath isn't too difficult for them. Once they're through the COVID, I have not seen a single patient be double diagnosed to become negative and then positive again.
Are you feeding them oxygen?
Most of them you have to, because it does affect the oxygen consumption in the body.
Okay, and what would the average age be?
I don't, I truly couldn't answer that as a worldwide thing, but from my experience would be about 60 to 80.
Okay, so, but that doesn't mean that if you're 25 or 30, you have nothing to worry about. Am I correct?
No, sir, it does not. You are still very susceptible, whether you're 25 or 32, 43. You're still a human. You have the same working parts.
And there are those who are in their 20s or 30s who have died as a result of the virus. Am I correct?
Yes, sir, there are. There are also people that have survived at that age, but yes, and it's very surprising when someone of the younger age succumbs to it, but it is possible.
So, what percentage of the population do you believe presently has the virus today and doesn't even know it?
I can't make a guess at that. I can only, from my personal experience, say that I can't guess at the whole population. From the nurses that I've worked with over the, say, even the past 60 days, I would say about 10% ended up positive, yet were asymptomatic. I heard this morning, I listened to an interview from a well-known, renowned pulmonologist out of, I believe he was out of Connecticut. I can't remember his name at the moment, but he put that number at approximately 30%.
Yeah, I heard something along the lines of that at least 50% of the population has been infected, and about 80% are not even aware of it. Have
I
you heard?
would have, I would agree that there is a large number that have been affected and wouldn't know, because coughing is a natural thing for the human body, and there's many things that would make you cough. There's many respiratory distresses that mimic this. I would say a lot of us have been affected by it and just simply don't know it, but our bodies were strong enough to fight it.
So I have two more questions I'd like to open, see if anyone else has any questions they'd like to pose to you. A lot of people look outside and they look out their window, and many can perceive death. Like, go out there, I'm going to die. And we keep hearing, stay at home, stay at home, stay at home. Let's isolate ourselves from each other so that we bring the curve down. We bring the virus down. A virus can't spread if we don't allow it to. So my question to you is, do we stay at home, or do we go out and use masks and social distancing? I mean,
The way people like to disobey the rules, I would say stay at home.
because you don't trust some people.
Some
Is that it?
some people just don't want to follow the rules. You know, well, I can't really call them rules.
Guidelines.
Yeah,
Guidelines.
guidelines. There we go. Some people just don't want to follow the guidelines, so the safest thing would be to stay in your safety zone, which is your home.
So if we all follow the guidelines, that is, you wear a mask and you keep distance from other human beings, 6 feet and or more. If you did those things, you would be relatively safe, and there would be less isolation. But given that part of the population is either ignorant, inconsiderate, uh, they destroy it for the rest of us. Would that be correct?
Yeah. One bad apple will ruin the bunch.
Okay, and my last question to you for now would be, I know you have a dog. Your dog's name is MJ. Very, very beautiful dog. We even had the pleasure of spending a night together, just the two of us. Took a little while to get used to each other, but by the end of the night, we were both licking each other. Well, he was licking me anyway. I wasn't licking him. Can you get COVID from an animal?
I do not know. And I've actually tried to research that. I can't seem to find a factual answer behind that. I do not know, but he is my companion. So that is just a risk I'll have to take because we do not social distance.
Okay, so I've read from CDC and from other sources that it's extremely rare for an animal other than the human species. I mean, they have their stuff, we have our stuff. Extremely rare for a dog or a cat to pass it on to a human being, or for a human being to pass it on to a dog or cat. Although I think we're talking out of thousands, tens of thousands of people, they've discovered a few animals, 5 or 6, maybe 8, between some tigers and in the Bronx Zoo and some cats, I believe, in China that were testing positive. But for the most part, they say it's extremely rare and that animals do not pass the virus between others. So let me unmute some good people that are here. Sammy, Rebecca, and Andy. You guys are unmuted. And do you have any, and Jeremy is unmuted or has to unmute himself. Any questions that you may have for LaCasta?
I have a question. It's Andy.
Go ahead, Andy.
When I go out to throw out the garbage, I wear a mask and I wear gloves. And if I walk around the neighborhood, I may be paranoid, but when I come home, I take my clothes off, go in the shower, and wash my hair. Is that going overboard?
Nobody has honestly tested hair, but that is exactly what we do. When we come home, we take our clothes off and we take a shower in washing our hair. Now we have just gotten to the point where we just cover our heads because it's becoming very hard on us women to wash our hair every day if we're not used to that. But that is safe because your hair, it is a fiber. It will collect germs. It collects dirt. I don't believe you're being paranoid. As soon as I come home, I take my scrubs off and I go shower.
So along those lines, should I be? I've trimmed my beard considerably, not just colored it, but trimmed it as well too. Should I shave it off?
I think that's personal. It's a hygiene thing. I do, just logically speaking or looking, I would think that a man's beard would collect more germs because it is centered to your face. But I think that's a personal thing as long as if you stay hygienic. I mean, looking at it scientifically, just stay hygienic. I'm not a big fan of the big bushy beards anyway.
All right. So also given my age, I get less to worry about over here. Like Jeremy would have more to worry about. Am I correct?
Yeah, Jeremy, he has a full head. You're running a little race there with Mr. Clean. So, but it's about hygiene, just like hand hygiene. It's just a different part of the body.
So, I mean, Jeremy is one damn good-looking guy. I mean, you wouldn't want him to be shaving his hair off, would you?
No, Jeremy, please do not shave your head.
Thank you.
Andy, do you have any other questions, or Sammy, or Rebecca, or Jeremy?
Well, I have a question.
Let's have a go.
I live in Manhattan, the city that never sleeps. This is a ghost town. I've been isolated for 6 weeks. If I'm taking the proper precautions, because I'm very high risk, my age, diabetes, high blood pressure, besides going to the store, is it okay for me to go out and to have fresh air and things like that?
Fresh air and
Because
sunshine
we have to be inside according to the blast of to come for another month at least.
I myself think that is a necessity. There are certain vitamins that the body can only produce when it's exposed to sunlight. I do believe that some of us, and I'm not an expert, I'm not a doctor, I'm not a nutritionist, but it is a proven fact that the body cannot produce some vitamins without exposure to sunlight. We still need exposure to sunlight. Fresh air is still good for you.
So
As
along those
long-
lines, I've read that it's important to be taking vitamins. Is this true?
It's important for anybody to take vitamins at this stage because, or at any stage in life, no one gets everything that they completely need through their diet. Vitamins are something you should always consider taking, a good healthy multivitamin, just for standard health, even
And-
before and after.
And of all the vitamins that one should take, let's say, not just to stay healthy, but perhaps to, boost your immune system in the fight against the coronavirus, which vitamins would you, or what minerals would you suggest that one especially take a look at?
They suggest that those of us in the healthcare field take vitamin C and zinc. I know many people have seen the little advertisement for like things like Zicam or Cold Ease. They're high doses of vitamin C and zinc. It's proven that zinc burns viruses, well, helps the human body burn viruses. They don't know exactly why, but it is just proven that it does. And so they're suggesting that us healthcare workers take more vitamin C and zinc. Vitamin C boosts the immune system, and zinc helps to burn viruses.
Now, let me go to another part of the world where Jeremy is sitting in beautiful Tel Aviv, and Andy is in Netanya city, which is north of Tel Aviv. So this is really truly a beautiful global conference that we have here with representatives from the Middle East. And Sammy is from New York. And so what I'd like to ask in that respect, in that regard, is do you see us coming to the end of the tunnel? Do we see some light at this point right now? Are we on the other side of the curve in terms of, being able to open up and go out more and go to stores and, try to get back to more of a normal routine?
That's a very hard question to answer, Joel. I think that at this point, that's not something that we're not ready. We are not well educated for this. This has only been around worldwide, globally for 6 months. We could use China as an example, but in my personal opinion, I don't think that we're ready, especially for global travel.
So where most of the world, whether it be here in New England or where Jeremy is or in Europe, many countries and many cities are now starting to open up. But they're doing so with precautions. In other words, instead of the restaurant opening up and just opening their doors and saying, hey, come inside, no, they're opening up with 50% occupancy, or they're opening up with 25% occupancy. So they're able to distance, in other words, it's every other table, that sort of thing. Does that sound fair?
It sounds logical and again fair. I mean, we have to stay socially distanced, but then again, we have an economy that we have to support. I truly don't know. From the personal view, I just can't imagine being a person right now that I don't know how I'm going to feed my family because I work in the restaurant or hospitality industry and it's dead. I've seen one place where I reside at the moment. They are building big giant plexiglass booths around tables that are every 8 feet apart. Mom and pop eatery. I guess is a test site. I can't answer that. I don't know if it's safe, but yet we have to think of a way to save our economy, everybody's economy.
So we could be walking into restaurants, and instead of just sitting down, we're walking into a booth, an enclosed booth.
Yes, I've seen a place that is going to test that theory where I reside in Texas. We have a homeless shelter that had to close its doors due to social distancing. They built booths, plexiglass booths for people to sleep in to keep them separated from each other.
So, but how does the air work? I mean,
That I do not know, sir. It's circulated air. I don't know.
all right, okay. So I guess there's still a lot of challenges ahead that we're facing. So, can we feel safe just putting our mask on, our N95? Again, I want to make a distinction, and I love you for really being able to disclose some information that we're not getting on the news, and that is there's only one mask out there which will prevent us from getting sick. We want to prevent other people from getting sick too, but there's only one mask, and that's the N95, which will prevent the person who's wearing the mask from getting sick. So if we wear that N95 mask, and when we practice social distancing, are we safe outside?
They say you are. I'm confident with wearing my N95. It is not just the fact, though, now that I think of it, it's not just the fact that a surgical mask isn't of the same grade as an N95. A surgical mask is not form-fitting. If you notice, if you put on your surgical mask, it just ties around your ears or around the back of your head. But N95s have that special piece in them that make them form fit and tight seal to your face so that you can't suck in any outside air. The ear loop one.
So here I have a N95. Let me just clarify that. It says N95, NK. What does the NK stand for?
I don't know what the KN stands for, but the KNs, the difference in those is they don't fit quite as tightly. They suggest that somehow you pull those loops together tighter. We wear these tights that have the elastic band on them so that they tightly form fit to your face. A lot of us have permanent indentions in our face now or brown marks across our nose because they form fit and they have the elastic. Those are made of the same material, but they don't fit as tight because they loop at your ears.
Am I getting less oxygen if I'm wearing this?
No, you're still getting enough oxygen.
Can I run wearing this mask?
I think that all depends upon your body. I personally can't.
No, I'm not talking about being able to run. I mean, I know I've gained like 15 pounds, and I was
They
already
are
overweight.
harder to breathe through because, there's a barrier between you and the air. But I've seen plenty of joggers wearing tight form-fitting N95s. I guess it would just be something you would have to adapt to.
All right, so again, I just want to,
Joel, I have a question.
project an advertisement 1 second. Again, if you're going to be wearing a mask, I mean, first of all, wear a mask. Please wear a mask. it will protect others from getting sick. But the best mask, and there are differences, and they're not saying this, there are differences in masks, as there are differences in cars, there are differences in skis, there are differences in the foods we eat, the quality, that the N95 mask will prevent you from getting the virus. It will not go through this thing. Other masks, it might, or it may. Am I correct, LaCasta?
Yes, sir. They're a different material and they're not form-fitting.
Now that I know this information, and I want to get an N95 mask, where can I find it?
Right about now, that's kind of difficult. But baseline normalcy, you can find them Walmart, Target, paint stores like Benjamin Moore, Home Depot, Lowe's, places like that, hardware stores. Again, the N95s are the same masks that the painters, well, not the same, but painters wear them that have the little boxes on them. You can actually buy some that are plastic, hardcore, that just have a filter that you replace.
All right. So where we have these masks over here,
That's a standard surgical mask.
and we have this,
That's a KN95, a loose form fitter, and this is an N95. It has a metal bar to form fitted across the bridge of your nose and elastic to hold it very tight.
okay. So again, just worth repeating. If you care about others, which I'm sure you do and you're watching this video, please wear a mask when you go outside, especially if you're going into an enclosed area such as a supermarket. Which brings me to now another topic, which I'd like to bring Jeremy and the Israelis into. We're going to have Memorial Day tomorrow. Tomorrow, once a year, we remember our fallen soldiers. And on this day, we have normally thousands of people that visit the graves of their fathers, their brothers, their sons. And I believe at first they were told, no, you can't go. I think they've changed that decision, Jeremy.
No.
No.
You still can't
there's been
go?
no change.
There's been no change.
There's been no change, and no one is allowed to go to the cemetery.
Okay, so I'll be honest. As the publisher of the Israel News Agency, I've already put out a message saying, go. Go. Wear a mask, practice social distancing, and go. Because what is the difference between, and I'm very cautious, and I was in the military for many, many years. I've taken courses in NBC and nuclear, biological, chemical attacks, and so on and so on. And I'm saying go, but go and wear a mask and use social distancing. What is your take on that, LaCasta, as a medical expert? I mean, can we say to people, go visit your son, your father? I mean, as long as you wear a mask and you're using social distancing, or has the government gone too far in that respect?
We need to follow their recommendations. We need to follow the recommendations of the specialists and the people that know better.
But you're a specialist. You know how this disease works.
I'm not a specialist. I'm just a nurse that is committed to working with COVID patients. I am in no way a specialist.
If your father was one that had fallen, and tomorrow is the day that you would normally visit his grave, would you?
No.
No, I would not. To protect myself and other people, I would not. I've been involved with the military since I was 18. I've not served as active duty, but I'm very knowledgeable of the military and the way they work. My son at this moment lives aboard a military base. His father has just recently retired from the Army after serving his country for 20 plus years. I would not, because the way I see it, I can memorialize and honor them wherever I am.
Jeremy, what's your take on all this?
My take is very simple. You follow what the government tells you to do. The last thing we need is anarchy and chaos and people not listening to government rule. Whether or not they're right or wrong is another story. But for now, and under the very intense time that we're living in, and the highly contagious, viral outbreak that we have, do not post anything that contradicts government mandates.
I agree.
I agree too. I usually go to the cemetery to remember the soldiers here in Netanya. I won't go. Independence Day, I'm home. There's plenty to watch on the Zoom, YouTube. We have a battle, and the battle is coronavirus, and we need to win. We need to win this battle.
Are there a lot of people that you've discovered, let's say in Israel, Jeremy and Andy, that have taken on the attitude that I have, that is, hey, come on, I'm going to wear a mask, I'll use social distancing, and I'm good to go? Because I've read there's a lot of conflict between those who want to visit their relatives and those who say, no, follow the government's guidelines. Then again,
I
Israel's
see
a
most people following the government guideline. There's a synagogue behind me, and I watch them every morning and evening praying, following the guidelines, praying with mass, 19 men apart, praying, even on Shabbat. Once more than 19, they had to leave. You have to follow the laws. The government knows there are leaders.
Is there
All the stores are following the guidelines as well. Everyone's doing social distancing. There's lines, huge lines right outside every supermarket and small store that exists in Israel.
All right, so I was going to use that as a point of case.
Stopping people too.
There are people saying, hey, I can go to the supermarket, I can buy a can of beans, but I can't visit a grave.
Eating is a necessity.
Okay.
If we don't learn from history, we are doomed to repeat it again. In 1917, 1918, 1918, Philadelphia lifted their quarantine and had a parade for the World War II efforts, which once again supported our soldiers and our military. 20,000 people attended that parade. In less than 7 days, the hospitals in the state of Philadelphia or in the city of Philadelphia were overflowing with sick people. They said it again, they said it was Spanish flu, but they truly do not know because we don't have the testing for it. The second wave hit, and because they lifted the quarantine, they didn't listen to what the government said, and our losses multiplied by 20 million. In 1917, we only lost 2 to 3 million people. In 1918, when people started lifting that quarantine, not listening to what the government stated, the country lost over 20 million people.
So your message to those who are living in Israel, just as an example, those who want to visit the graves of their relatives, you are saying
stay at home.
Stay at home. Do not.
No, follow the mandate, because it could like Jeremy stated, it could cause anarchy. And besides anarchy, it can infect so many more people.
But aren't there a lot of double messages? I just got a chat from someone here saying, hey, but I'm allowed to go out and I'm allowed to go out and exercise. I can.
But Joel, now I'm going to cut in and I'm going to become the expert here, all right? First of all, what you're doing right now is completely unacceptable. Completely 100% unacceptable. That you're asking someone basically defy the orders of the state of Israel, the governmental orders, to purposely go because in your own mind, it is allowed to. Whether it's allowed to or not allowed to, or risky or not risky, or healthy or not healthy, is not the question. The question is, actually no, not even the question. The orders are, do not go to the cemetery. The IDF Chief of Staff, Aviv Kochavi, said this morning, respect the orders. Because I know this is very painful. I know that you have families. I know they have loved ones that have died. And it's a tradition to go every time. This time, do not go. Respect the orders. These people are not stupid. They're doing this on purpose. And by the way, let's say someone does listen to someone that says go to the cemetery. At best, they're risking to get a fine and having an attack with a police officer.
So where I read yesterday that this order was rescinded, that's not true?
That's not true. Where have you heard that?
All right. Usually the Jerusalem Post or the Times of Israel. I read that the order was rescinded.
No, it wasn't.
But I concur again. We got different cultures, LaCasta. Israelis are known for being very independent. They'll speak up. Moshe Dayan, private, will tell Moshe Dayan, general, what he thinks of things. Doesn't accept everything, will speak up. As opposed to, let's say, other cultures in the United States. The government says something, follow it. And when the Israeli government says something, and I agree with Jeremy, if the government is unified in a message and is saying, do this, then I am fully behind a unified message. If the prime minister is coming out with the words of advice by his medical experts and the IDF that I have tremendous regard for are saying, follow these rules, do not do this, and so on, then that's what we must do. I totally agree. Any other questions for LaCasta in regards to contracting the virus, what one should do if they have the virus, and any future outlooks in terms of what we're facing, the challenges? Are we looking at another few weeks? Are we looking at a year, 2 years?
Sammy, you had a question.
Well, I had one. I don't think there is a good answer. The issue that I am perplexed is I'm looking at China. They have 1.4 billion people. And somehow either they have a cure or the numbers are totally incorrect, because it does not make sense that they are not affected by the coronavirus like we are. It doesn't make sense. 1.4 billion. Do they have a cure? Okay. How is it possible that they are not affected?
Sammy, I believe they are affected, but the distinction between China, Israel, the United States is that this is an extremely strong authoritarian government. They locked down Wuhan. And when I mean they locked it down, they locked it down. When they tell people stay inside your home and do not leave the city, they enforce it. And they enforce it not even so much with a fine. They'll shoot you. I mean, it's a no-nonsense take. So I've read and I've seen accounts whereby whether you agree or disagree with what form of government they have.
The numbers are okay. I'm not talking about the enforcement. I know that. I know I live in a communist country. I'm talking about, how come the numbers are so low? It does not make sense unless they are totally lying and millions of people have died, or on the other hand, they have a cure.
LaCasta, what do you think?
I think the numbers make sense because, simply plain and put, Americans don't listen. We are we are strong-headed. We have this thing here called the Bill of Rights that we think we can do whatever we want, and we revolt against our government way too much. China, they have a different governmental system, and as you said, they were shooting people for not following those orders. Right here, we were under a stay-at-home order, social distancing, but you drive by the governor's mansion and there's people protesting to open up businesses. You have the mayor of Las Vegas, who is getting ready to open her whole city back up. That wouldn't have happened in China. It was not allowed. If our country would follow those type of guidelines and hold that strictness as well, our numbers and our curve would begin to flatten as quickly as China's did. China has they listened. They did not revolt against their government.
So you believe that the numbers are correct?
In all honesty, I do. I don't think that there's some underlying scheme that they have a cure or they started this. I simply think that it's the fact that those people stayed at home and respected what their government said.
Interesting.
What do you see now as our greatest challenge, LaCasta?
And this is all personal opinion, but our greatest challenge is going to be listening to the rules and regulations that we are given. I understand that we are a free country and we have fought for hundreds and thousands of years for our Bill of Rights and this and that, but this is way beyond that. It's way beyond. We need to follow the countries whose curves are completely flattening. For example, China. They followed what they were told. They listened to their government mandate, and we see the proof. I don't think that there is some strange conspiracy out there that they have a cure. We are not listening as a whole.
I have to say, I'm a little perplexed. I'm bicultural. I'm half American, half Israeli. The half American in me, in the state that I'm living in right now, says you must wear a mask when you go outside. They don't care where you go. If you're outside, you wear a mask, whether it be a supermarket or whatever. And I follow those rules. I follow all the CDC rules. Now, that's the American. The Israeli in me, where I lived for 25 years, they say, don't visit your relatives at the funeral. And Israelis are very famous for being extremely independent. Is that wrong right now? I believe you're saying
personal choice.
I believe you're saying it's wrong.
I really think we should follow government mandate. We need to set aside at this point, we need to understand that the individual is not the most powerful thing right now. It's the most dangerous thing.
Jeremy, what you think Israelis will disobey these orders by the IDF?
I believe Jeremy may have left us. That is a standard picture.
Yeah, he hasn't. Either he's frozen or he's put a picture up. One of the two.
Jeremy is muted. You have to unmute him.
Jeremy, can you hear us?
Can you hear me? Can you hear me?
Yeah, I hear you now. Yeah, there you go.
Okay, yes, sorry.
Good seeing you. I don't like looking at you frozen.
The question is about the government regulations.
No, it's about the culture, the Israeli culture. You can tell Israelis what to do. Will Israelis follow? I mean, do you think they'll adhere to, let's say, not going to Har Herzl?
Yes, everyone has been following. I would say 95% of the population has been following very thoroughly the government regulations, from the stay-home orders, wearing masks, not going to cemeteries.
What do the newspapers say about this? Are the newspapers behind the government?
Most of them are. I mean, some of them are saying that they're opening stores too early, that we'll have a wave of coronavirus infections because of it, a new wave. LaCasta, what do you say about it?
It's a lot of mixed messages. We're opening the store up, and you can't go to the grave. I don't get it.
No, of course,
Because
it's
going
mixed
to
messages.
visit a
But for
grave
now,
is
this is what
not
the
a
government is saying.
My personal opinion, Jeremy, is that we need to listen. We need to follow the mandates. There's a difference between going to visit a grave, which is not a necessity. Some people can't grow or go hunt their own food, so they are forced to go to the grocery stores. Not everybody is in an area where they can go throw a fishing pole in a pond and catch their next meal or hunt their next meal. Grocery stores are necessities. Visiting graves are not a necessity. Going to church is not a necessity. You can honorize and memorialize anyone wherever you are. It's a thought process, not a physical place of being.
Agreed, but Israel's also opening up non-essential stores.
John,
Right now, we're starting to open up the whole country, slowly but surely. The small stores, you know, hairdressers, manicure, pedicure, they're all being open as of today. But do you agree, LaCasta, that if we do it too fast, we could be seeing a sudden surge of infections, new infections?
I do agree. We need to go slowly. This is new territory for us. You don't just jump into the fire. You slowly roast the marshmallow.
I
You know,
also, I also believe, I
if you
also
look
believe
at-
that the media is playing a very full role in convincing the people to follow the rules of the government. I think that the media is also guilty of not having a very, very strong message to follow the rules.
I
That's my
agree.
opinion.
The
US
media is very
ambassador,
powerful.
the U.S. ambassador was only one of 10 who went to the Holocaust Memorial at the wall. Only 10 people were allowed at the wall for Memorial Day. April 25th is Anzac Day, and the Australian ambassador did not have a big get-together. It was just him and his attaché who laid wreaths. So when we look at ambassadors who are following the laws, I see Israelis who are very pushy and why should I have to listen? I see Israelis changing. I see people coming together. I
Really,
see
wow.
kindness. I see younger people in buildings knocking on doors of elderly people who cannot go out. I've been in lockdown for 6 weeks, 6 weeks. And I have somebody deliver my groceries. I have somebody who delivers flowers for me on Shabbat. There's kindness that I have never seen in the 14 years. So yes, if you look at the good, there is good here with this coronavirus.
I agree with that as well, Miss Andy. I think that maybe, especially in America, the good that we see is it's going to teach us to value our families again. It's going to teach us the power of and the strength in family.
I have one more question. What do you recommend for people to do to be careful? Just to be careful, besides wearing a mask and keeping away from others. How do we mentally keep ourselves sane?
Mental health.
Mental health is a very big issue, a worry that I have. I have a lot of friends that have mental health issues, that there are people that don't do well be isolated, but you have to find ways to make yourself feel good. Exercise is one of them. Exercise releases natural endorphins and natural hormones in the body that just make you feel better. You have to find ways to just make yourself feel better. And another thing that people will help keep you safe besides your mental health, maybe I don't know, I do various things. I'm not much of an isolation person. Exercise, find a hobby. I've seen a lot of people that have learned to knit and crochet and do very things that have been lost in the past. Telemedicine is still alive and well. If you need, reach out to counselors. They're available through your phone, through the computer system. Mental health is something that we haven't really looked at.
I agree with you on it ever being quote unquote out of control. And
So LaCasta, let me ask you. You being on the front line and not just being exposed to the virus, but being exposed to the abundance of emotional, like a tsunami, like the emotional distress that you're exposed to. Do you and do other medical care experts seek out advice? Is there counseling there for you and for others?
There's counseling available for everybody. It not just us, but for us, yes, there are people that have put forth extra effort. The company that I work for actually will provide you with and pay for counseling if you feel as though you need it. But the best thing is just pick up your telephone. Pick up your phone and call somebody.
Is it mandatory?
No, it is not mandatory. It is optional.
Do you believe that
Uh,
most healthcare professionals today need counseling?
I don't have an answer for that one. Everybody handles everything differently.
LaCasta,
Yes, sir.
I have a question for you. I mean, of course, no one has the crystal ball and might know the exact answer, but the global tourism, when and if you think this will occur again?
The global what, Jeremy? You got blurry in your speech.
Sorry, the tourism, all the global, traveling.
Ooh. I don't know. That's pretty risky. I don't. Right now is not the time. My family has been affected by it as well. I have a child that lives overseas. He wasn't able to come home for vacation like he does because he would have to travel globally. I don't have an answer for that, but until this curve starts to flatten globally, I don't think it's a good idea.
Right. I mean, here in Israel, not written in the media, of course. Nothing written about the media.
It's hard for me to hear you, Jeremy.
Can you hear me now?
Yes, yes, yes.
Okay. No, because I mean, here in Israel, nothing's been written in the media about the return of tourism. Now it's more about the death of tourism. But what people who work in the tourism world are saying is they're saying late August, early September.
Say that again.
That's a guess.
Say that again, Jeremy.
They're saying late August, early September for any form of return to tourism.
LaCasta, what do you think?
I don't have an answer for that. I truly don't. It all depends upon how well we do with this, how well we can flatten that curve and get rid of new cases of COVID.
Just for your information, LaCasta, Jeremy is the global ambassador for one of Israel's leading hotels. So he knows tourism. He knows the tourism industry. He's a professional. That's what he works at. So when Jeremy of all people will ask a question like that, it has a very, very strong impact. And a good deal of what Israel, we're talking about one country right now, not Italy, not England. What a good deal of how this virus is affecting, besides the economic impact, is when it comes to Israel, is tourism. I believe that our greatest revenue, and correct me if I'm wrong, Jeremy, in Israel, would be tourism. That incoming. The outgoing is how we export high tech. We export high tech products and services. But incoming would be tourism. Am I right on that, Jeremy?
Right.
So maybe Jeremy has to start thinking about becoming a farmer or something.
Well, I mean, it is true that the other regulation that Israel has done is that any tourists, even Israelis, of course, that re-enter the country, must go into I mean, we set up hotels to be as a quarantine basis, also to treat more corona cases as well. But the thing is that if you come back into the country, if you enter the country, you must go directly into quarantine for 2 weeks. Do you think that's legitimate? I mean, do you think it's a good idea?
I think that it's safe. We hold 2 weeks quarantine here with us healthcare workers. When we go from site to site, when we leave one facility, we have to quarantine ourselves for 2 weeks. I
Right.
say that is legitimate.
Now, I believe the quarantine period set for 2 weeks. is set upon and was established because that's the incubation period of time for the virus to manifest. In other words, if you got infected, you would know within 7 to 14 days. Is that correct?
That's what I've read, yes. And that's what we're basing our 2 weeks, the medical or the healthcare field, those of us that are going from facility to facility, that's what we, how we are looking at it, is if we have been exposed, we will know if we're positive within 2 weeks. That leaves open the asymptomatic people.
And how do you know if you're asymptomatic?
That's the problem. You're asymptomatic. You don't know.
So we need more testing.
Yes, I think that we do. I don't know if it's true, but I read where they're getting ready to set up several sites here in New England that'll be able to test up to 10,000 people in a few days, and it will be absolutely free. Something like that would be a good idea. But I am a firm believer in the 2-week quarantine.
Okay, I just want to say before we wrap things up, if anyone has any more questions, that if anyone has a need for food, if you find that you have a hard time in terms of having access to food or being able to purchase for food, please know that there are thousands of food banks out there, whether you're in the United States, you're in Israel, you're in Europe. There are thousands of food banks out there. I know I volunteer half my time being part of a food bank, that you just go down and you don't have to identify yourself. You don't have to say where you're coming from. Get in your car. They see you, you get in line. You open up your back trunk. There's no direct contact between the volunteers and the staff of the food banks and you who are, perhaps needing food. They just put the food in your back trunk and you've got good food there for a week, maybe even a few weeks. And these food banks are open daily. Most of them are open Monday to Friday. If you're, again, if you're needy, you don't have the money because many of us are now unemployed. We don't have payroll checks coming in. Food bank, nothing to be ashamed about. We're all in this together, as they would say. Any other questions for LaCasta? Well, LaCasta, I've gotten to know you, and I'll be quite honest. The way I've gotten to know LaCasta was that LaCasta was a neighbor of mine, and LaCasta would go out and she would work her midnight shift, and her dog MJ would stay behind, and MJ didn't want to be alone. So he would start howling at 2 o'clock, 3 o'clock at night, and I didn't know what was going on. And so we knocked on a door and we got together and we made sure that MJ wasn't going to be alone. No human should be alone. No animal should be alone. So we have the internet, we have Zoom, and we have social distancing. But I have to say, out of all the people that I've come across, LaCasta, you're a rock star. You're definitely you're among the heroes of the heroes. I mean, I know first responders. I was one. I was military. I was police, but I was never wearing a white uniform, going into the battlefield every day up against an invisible enemy, swallowing it all, being as diligent as you are and as dedicated as you are in terms of saving lives, and coming on here and providing a lot of insight as to how the disease works, what we can do to protect ourselves. And in doing so, you're doing this after having worked all night. You worked an entire night shift, and it is now just about 11:45 in the afternoon here. So there are just two things I want to say to you before we say again, thank you. And that is, get some sleep, and thank you for being who you are. Thank you for what you're doing.
Well, I appreciate all that praise, Joel, but I'm just a nurse. I signed up for this, and I'm just a nurse. I'm just a regular person. But I thank you for the praise.
Jeremy?
Yeah, can you hear me now?
Yes.
Yeah, no, I just want to thank you once again. Also, for devoting your time, your precious time now, especially since you're helping everyone physically on the ground, which is a much more important battle to take care of. But honestly, thank you for everything you do and for speaking today. It was truly informative, and you know, we're here to support you, whatever you need.
And
Thank
Jeremy,
you.
I would like to thank you, Jeremy, for speaking up, for being an honest Israeli and saying, no, follow the rules of the government. If the government says do this, then stop being an arrogant Israeli and listen to what they're saying and follow it. Don't disagree, just swallow and follow it and keep people safe.
Always a pleasure.
Andy, Rebecca, Sammy, and to all of those of you out there that'll be watching this video in the hours and days to come, we only wish you the very, very best. We know that this will come to an end. We know that one day we'll look back at this and smile and laugh about it. But while we're going through this, it sounds kind of trite that we are going through it together. And as long as we're able to communicate and talk to each other as we are right now, using Zoom, using Facebook Live, whatever, we can connect. And as far as our mental health is concerned, as long as we're talking to other people and we're able to express ourselves, that's so, so very important. Also, there are a lot of animals out there too. There are a lot of dogs and cats that need to be rescued. If you find that you're living by yourself, you're completely and totally isolated, which you're not because you've got internet. You could, go down to a shelter and rescue a dog or a cat, which is really a great companion. That's my very last question to LaCasta, because she has MJ. What do you think of that idea of going down to a shelter and picking up a dog or a cat?
I am a dog lover. I think it's a great idea. I do. I really do. They need love just like we do. They're pack animals just like us. I think it's a great idea.
LaCasta, thank you so very much for your time and for your effort this morning. Thank you so very, very much. I can't articulate how grateful that all those who are watching you and listening to your good words of professional advice. On behalf of the United States News Agency, the Israel News Agency, and the Jewish News Agency, thank you again. We look forward to having you online again. And to all of those of you who are out there, stay safe, stay healthy. Thank you.
Stay safe and healthy. Be blessed.
Yeah, stay safe and healthy.